I am running so super late this morning, which is something that I hate. I honestly cannot stand rushing. But today I am going to Beverly Hills to see my friend who's a doctor, and I'm going to have Botox in my jaw, which will hopefully help with tooth grinding. Just to clear up a few things about Botox, if you aren't familiar with what it is, it's basically a neurotoxin, and it is injected in various parts of the body to relax muscles, essentially paralyzing them, which sounds very scary, but I think there are a lot of great uses for it in medicine, aside from just aesthetics. I am not here to promote plastic surgery or any type of cosmetic surgery, whether it is used for aesthetics or as medical treatment. It is a very, very personal decision, and I do believe it's really important to do your own research if you're even considering it. I have talked in the past about how I suffer from headaches and migraines. I think there are a lot of reasons why I personally get headaches. First being stress, second, probably genetics, because my dad also gets migraines. Other than that, I think two main triggers for my headaches are sinus issues and allergies, and the fact that I am constantly grinding my teeth. Like, it's not even something that I just do when I'm sleeping. It's something that I do endlessly throughout the day, every single day. And I mean, I guess it's like subconscious, but I do catch myself doing it. I actually will edit out parts of my videos when I'm editing because I'll be like clenching my jaw and grinding my teeth so hard. It's crazy. I also just had 12 teeth fixed. Several of those were chipped from grinding, and even my front 2 teeth and my bottom like 4 teeth have fractures in them from continuously clenching my jaw. And I just felt like if there was something I could do that might possibly help, I'm open to it. Now, my friend is doing the procedure. I've known him for about 4 years, however long I've lived in LA. We met shortly after I moved from New York. So he was actually the one who told me about this procedure like maybe 6 months ago, I want to say. One of the reasons it took me so long to commit to the idea is because it does have the potential to slightly change the shape of your face, which is the scariest part to me because I personally like the way my face looks. I have no issues with it, and I don't want to change it. The reason that can happen is because when it does relax your muscle, you're not using that muscle as much, so it can have a less prominent appearance. And obviously my jawline is very strong. I do think part of the reason my jaw looks so boxy is because I use this muscle very often when I'm clenching these muscles together. So ideally, I hope that it has no effects on the way that I look, and I have talked extensively with Dr. Cabin about this, and we're gonna start off with just a very small amount, and if I do end up liking it, then we can do a bit more in the future. I do think being conservative is always the best approach, especially if you're not quite sure, so that's what I'm going to do. And as I said, I am really running late. I should have already left probably like 5 minutes ago. I'm gonna grab a little snack, like a rice cake with peanut butter and some water, and head over there. As we are driving into Beverly Hills, technically right now we're in West Hollywood, but we are about to cross over the border. I wanna give you a brief history of Beverly Hills. I think I've only gone there maybe to go shopping like one time, and I've gone to a couple of doctor's appointments out there, but otherwise it's quite a rich area and it just feels pretentious. I mean, it's kind of like that stereotypical LA you see in movies and things like that. I just don't fit in, but I feel completely at ease going to see Dr. Cabin because he's a really down-to-earth guy, and it's gonna be great. Alright, I believe this is the building I'm trying to go to. I'm not quite sure how to get in. I feel like I'm entering a crime scene. Alright, we made it. Now we are going to the 6th floor. So we have arrived. This is Dr. Cabin. And we've known each other for like 4 years, right?
Yeah, something like that, yeah.
I've been in LA for about 4.5 years now, and I think we met right around the time when I moved here.
And right around the time when I moved here.
Oh yeah, so we both moved here from New York.
Rock and roll.
And we met at my former place of employment, which we do not discuss.
I don't go there anymore, so.
You don't? No. You don't go there because I don't work there anymore.
That's right, that's
yeah.
true. That's the reason
I have a whole video about that. So today we are going to be doing Botox in my jaw, right?
Correct. The back part of your jaw.
What is this muscle? The masseter?
Masseter.
And you told me that I had really prominent masseter muscles.
You do. You do. I'm attuned to that because a lot of people do, and most people don't know what that means. But it can make the back part of the jaw look a little wide, which some people like. But more importantly, a lot of times it's related to grinding, clenching your teeth, which can cause pain and damage your teeth. And so it's kind of one of these treatments that people don't know a lot about, but it's amazing for this kind of thing.
And we've been talking about it for like 6 months or something.
Yeah, you need a lot of information.
Yeah, I know. I'm honestly the most annoying person when it comes to any type of medical procedure. Like, you don't want to do anything on me.
You know, let's cancel this.
Quickly, I just want to clear up a couple things about Botox. I think a lot of people aren't completely familiar with what it is, and there's a big difference between different types of injections. Botox is a neurotoxin.
Correct.
Which essentially paralyzes your muscles.
Correct.
It is preventative in a lot of cases when it's used cosmetically.
Sort of.
Okay.
So one of the things it does is, one of the main things it does is it prevents wrinkles by reducing the movement of the muscle that's causing the wrinkles. So if you have fine lines and wrinkles around your face, it's not going to do much for that. But if you have, for example, these lines here, even when you're relaxed, that's from the movement of the muscle reinforcing the skin in that area. And if you can relax that movement, you can actually reverse that wrinkle by giving it time to rest and fill back in.
Huh.
And then you can prevent it from coming back, or you can prevent it from happening in the first place by doing Botox regularly.
So my main concern with getting Botox here was changing the shape of my face, which I asked you a million questions about.
Yes.
Because I would prefer to not, I mean, I like my face generally. So we're going to do kind of a more conservative approach and see how it goes.
Sounds good.
Anything I should be aware of?
It's actually a really easy one. Just getting it into the muscle in the right places so that we reduce the strength of the muscle and trying not to reduce the size of the muscle, although as we discussed, may reduce a little bit.
Yeah.
For you in particular, I'm going to go really minimal.
Okay.
Do like half of what I normally do.
And how many units is that?
It's going to be 15 on each side.
So 30 units total, which is kind of a lot. I mean, how many units do people get generally for Botox in their face, like around their eyes and forehead and stuff?
Usually about 30 to 50.
Okay.
Contrary to popular belief, the masseter muscle is the strongest muscle in the human body.
Really?
Yes, right here on the back of the jaw. That really, it has a bunch of purposes, but the main one is for chewing. It is the strongest pound per square inch muscle in the body, and the reason being is that we evolved to chew really, really tough things when we were hunter-gatherers. We don't need that ability anymore. Maybe if we're eating like some really tough vegan beef jerky. But well, what happens is at night when we're subconscious and we're sleeping, a lot of times we activate the full pressure of the muscle to grind our teeth, and that can cause pain. And when you reduce the pressure of the muscle down to a level where you can still eat, you can still chew, eat anything we normally eat nowadays, you can actually prevent the pain while not reducing any function. Does that make sense?
Yes.
Okay.
So what you're saying is, if I don't like how this turns out, I can eat you because the muscle's so strong.
Exactly.
Before the Botox kicks in.
Got it. Hit the nail on the head.
Okay.
So one of the most important things here is just really isolating the area you want to treat. And you can see here with Julia, which I actually like a lot of the definition she has in her jaw, but we're trying to do as little as possible cosmetically, but reduce the strength of the muscle. And a lot of the bulk of the muscle is right here. And so what I do is I have you clench down, and you can see that whole muscle is right around that jawline, and that's the area that I'm going to go in particular areas to try to reduce the strength without reducing the shape of the jaw. And I'm going to do the same thing on the other side. Bite down again for me. Good, relax. And the goal here is to go very deep, which is actually, a sound technique as opposed to going superficially.
Okay.
Cool.
You're a YouTuber now. I'm just doing a little bit of ice.
Icing is the secret to my success. It reduces some of the pain with the needle, and it also reduces the chance of bruising. It makes people feel cool, so to speak.
That is a long one.
For this area.
Okay.
So we're going to don't put your head back here. So I'm going to be crunched down again for me. Relax. And turn the poke. 4 pokes on either side. You want to spread it out as much as possible so that we don't get any area that's treated more than another. How did that feel?
Fine. I felt like nothing. Right side is done. Thank you.
All that buildup.
Yeah, that was nothing. I mean, I do well with needles, but pain was like a 1 out of 10.
Amazing.
I honestly feel like this side of my face looks weirder from the ice pack.
Yeah. So we're gonna do the exact same thing on this side. Sometimes, if I'm doing this cosmetically, sometimes I'll do a little bit more on one side than another if I'm trying to balance the jaw. I'm not worried about that. Poke here. A lot of people ask about why you don't use alcohol swabs here. I'm sure you're gonna get comments like, he's doing it, it's not sterile. You don't use alcohol with Botox because it can deactivate the Botox when it's going in.
I didn't know that.
And with the face in a healthy person, with a needle this size, there's almost a 0 risk of any kind of infection because there's so much blood supply. Bite down again for me. Good, relax. I feel like you should have one of the more you know icons come up with the little rainbow.
I need a better program. I still use iMovie to edit my videos, guys. Deep secrets. I didn't know that about alcohol deactivating it.
Yeah.
But I didn't question anything.
I'm preempting all the people that are going to comment on it.
I mean, I think this video will be more controversial for other reasons.
Besides my alcohol swabbing?
Yes.
Bite down one more time. Good, relax. This is like possibly my favorite in-office treatment because whether it's you're looking for a reduction of pain or issues with your teeth, or you're looking for reduction in shape of the size of your face, it's a very, very, very powerful effect with almost 0 side effects. So it just makes me happy to do it. We're done.
Very easy.
Thanks for coming in.
Yeah, thank you so much. Honestly, my face looks crazy only because of the ice pack, but the pain was very minimal and everything feels normal. It takes like 3 days for it to kick in, right?
It actually takes longer than that. So another fun fact about Botox. Botox takes 3 to 5 days to start working, but it actually takes up to 2 weeks to fully start working. So you won't get the full effect of the pain reduction for about 2 weeks. For people that are looking to do this to narrow their face, I usually tell them to wait about a month to see the result. The nice part though on the flip side is, as opposed to Botox that people may have gotten for wrinkles or in the upper part of their face, this Botox lasts a lot longer. So instead of 2 to 4 months, it lasts from 4 to 6 months.
And what is the average cost to get a procedure like this? Obviously it varies depending on where you go. I mean, I would definitely say for procedures that are maybe more complicated, go to a plastic surgeon versus like a cosmetic clinic, or definitely be weary from getting things on Groupon or anything like that.
Totally.
But if you were coming to a reputable doctor's office, what would the cost be?
I think probably for the masters, if you're getting a full treatment, you can expect to pay anywhere from like $750 to $1,000.
Okay, for roughly like 6 months of treatment?
Roughly 6 months of treatment, yeah. Unfortunately, even though this is treating a real medical issue, it's very hard to get it covered by insurance. When you're doing it for other medical problems like migraines and things like that, which is a whole different discussion, you can sometimes get it covered.
Cool, well thank you so much.
Thank you, Julia.
Later.
I'm finally home after sitting in traffic for such a long time. As far as my face goes, I have no swelling, no pain, no visible injection sites or anything like that. Everything feels good. After you get Botox, a lot of doctors will recommend that you don't lay down for several hours just so it doesn't spread from the injection site or migrate under your skin. Generally, you just want to take it easy, not do strenuous exercise for the next few hours, and just not lay down and go to sleep. So right now I'm about to make lunch, and I'm gonna show you guys a really easy recipe that I like to make. Also, I'm going to have to keep you guys posted on what's happening with my face, just because it does take time for the Botox to take effect. So this is gonna be a video where I give you guys updates, but for now I'm going to give a little cooking tutorial. This is going to be one of the easiest recipes I have ever made on my YouTube channel. All I'm going to use: broccoli, tomatoes, heirloom tomatoes, really beautiful, vegan mozzarella cheese, this is my favorite, and then I'm also going to be using some of these soba noodles, which are so good. This is obviously not a low carb meal right now, but that's fine. And I'm gonna make a little vegan mozzarella tomato salad, and then I'm going to do some basic just stir-fry noodles with steamed broccoli. I'm going to also use some sesame seeds. So 5 ingredients, and then maybe a little bit of olive oil, sea salt, stuff like that. First things first, you want to chop your broccoli. And now I'm going to boil a little bit of water. While my water is boiling, I'm going to go ahead and cut up my tomatoes. So, funny story, I pretty much hated tomatoes for most of my life. I don't know what changed, but it is true that your palate changes. I'm also going to cut some pieces of this cheese. Meanwhile, my water here is boiling, so I will gently insert my steaming basket, and then I will also put all of my broccoli in there. And I'll steam that with the lid on for maybe 4 to 5 minutes. In the meantime, I'm going to make my noodles. I just added a little bit of sunflower seed oil to the pan. I'm gonna turn the heat on. And before the oil gets hot, add a little bit of water. And I'm just cooking these according to the instructions on the back of the package. So I will also now add my noodles. You can find these noodles in the refrigerated section of some health food stores, and also a lot of Asian grocery stores. They should start to soften a little bit more in the pan and break apart. My broccoli is finished. Now I'm just going to add it in with my noodles, and then I will add the sauce packet or the seasoning packet over top. And I'm just going to continue cooking these in the pan for maybe about 1.5 minutes, 2 minutes. I'm eating this off the floor. Yum. And then with my tomato salad, I'll just do a tiny bit of sea salt and just a little bit of olive oil. And then I'll add just a little bit of balsamic vinegar, which has a high sugar content, so just a tiny bit for me. And there is my beautiful lunch. This really looks amazing. Can you believe how easy it is to make a lunch like this in under 10 minutes that is healthy and delicious? It is possible, guys.
Later.
I know it's dark in here, but I'm really excited to eat this. Melon is one of my favorite things in the whole world, which is another thing I did not like when I was a kid. Also, this is that yogurt that I got on my birthday that was super expensive, and I had a complete change of heart about it, and now I'm obsessed. I wanted to give you guys an update on how I'm feeling before I go to bed tonight. I'm not going to lie, I started feeling sick like a couple hours after I got home. and my jaw has definitely been a bit sore. So when I got home, I felt normal, and then as the day progressed, I just started to feel kind of under the weather. It is not uncommon for people to experience almost flu-like symptoms after they get Botox, and I didn't anticipate that happening to me, but it is definitely happening. I did go out to dinner with a friend tonight, and I was able to like get outside of the house and everything. I'm not like bedridden or anything, but I'm just not feeling great, so hopefully that will resolve in the next day or so. I think that's really all I have to say. I just wanted to do an honest update, but I will keep you posted on how I'm feeling. Hopefully I feel better in the morning. It has now been about 4 weeks since I got the Botox treatment in my jaw for tooth grinding, and I wanted to give you guys an update to let you know how I'm feeling, how it's working out, and everything like that. I'm also debuting a new haircut, which a lot of you have seen because I posted a couple pictures of it. The last time I filmed was the night I had the procedure, and at that point my jaw was feeling pretty sore, and I also felt like flu symptoms and pretty sick from the actual Botox. So that went away by the next day. My jaw did continue to feel like mild soreness, I wanna say for maybe 2 to 3 days, but it was very bearable and nothing too crazy. And I didn't have any other side effects besides those things. I wanted to make sure I waited several weeks before I give you guys a full update. So I feel like right now I have a pretty good idea of how it's working. I want to elaborate a little bit on that. The first thing is that my jaw definitely is more relaxed, and I wish I had gotten video footage of me chewing or like biting down and clenching my muscle, because when I bite down now, you can't see that I am. It's so weird. Here is how my jaw looks now when I bite down. You really can't even see the muscle flexing, I don't think. Maybe you can see it a small amount, but I really wish I had recorded that before getting the treatment, because it was like a very strong clenching that you could physically see, and now you can't even really tell. But it doesn't interfere with eating or anything, which is another thing that I was a little bit worried about. And I want to say after the first week is when I started noticing that I wasn't grinding my teeth throughout the day, which is something that I would do subconsciously anyways, but then I would catch myself doing it often. And that has not happened one time in the past couple of weeks. So that's a really good sign. Other than that, I have only had one migraine headache since the treatment, and that was yesterday. Typically, I get multiple migraines over the course of a month, and I've only had about one. I can't even fully attribute my migraines to tooth grinding, but I suspect that they're very much interconnected because of that constant pressure and the constant tension from grinding. So yeah, I've had one headache. I have had a big reduction in actual tooth grinding. I can't say what it's been like when I'm sleeping, but I definitely wake up and my jaw feels a lot less tight, like there's less tension when I wake up every morning. I'm curious about whether or not getting Botox in your jaw will help train the muscles to relax more over time so that you don't need to get the procedure forever. Because it would be really difficult to train your muscles when you're used to grinding your teeth so often. But I think if your jaw is physically more relaxed, then maybe your muscles become used to it, so they naturally wouldn't clench up as much. I think that it makes sense. If anyone knows more about that or has more insight on it, totally feel free to let me know in the comment section below. You guys may remember that one of my biggest concerns was whether or not it would change the shape of my face. And I do feel like it has very slightly slimmed my jaw down. I'm not sure if that's psychosomatic or what. Like, my face doesn't look very different from how it usually looks, but I do feel like my jaw is a little bit slimmer towards the bottom. And the reason for that, again, is just because I'm using this muscle less. I don't know, what do you guys think? I feel like my jaw previously was just a little bit more square. if that's something that would displease you, or if that's something that would really upset you, that is something to consider. One of the reasons that I wanted to film this video in the first place was that I did so much research on this procedure before I ended up doing it, and there weren't a ton of videos sharing personal experiences on it because it is still a relatively new treatment. I know there were several and they were helpful, but I did want to share my own experiences with it, and it might not be a suitable treatment for everyone. There are always different treatment options. I think one of the most common options is a mouth guard, and I do want to quickly talk about why I was not a candidate for a mouth guard, because when I posted that I was doing this, so many people messaged me saying that I should have tried a mouth guard first. So I have tried mouth guards in the past, and I plan on trying one again in the future just to protect my teeth. It's typically something you wear at night, and it doesn't prevent you from grinding your teeth. It just protects your teeth while you're clenching down, which is also very important. The reason that I'm not able to get one at the moment is because I am missing a tooth on the right side of my mouth, and it's been gone for about 6 years. And when you are missing a tooth for that long and you do not opt to get a dental implant or a bridge, the issue is that the integrity of your teeth, like, you know, the bones that are holding your teeth in place, your bone can start to shrink, the gap between your teeth will start to close, and it can really mess up like the integrity and the structure of your teeth, which is not good. So this is something that I need to fix as soon as possible, and I'm working on fixing that. It's something that will require me to get Invisalign or to get braces, and I'm not sure which route I'm going to go yet, but I have to get molds from my dentist, and then I need to basically move my teeth so that I can get a dental implant up here. Because we're going to be moving my teeth around, I can't wear a mouth guard while I'm wearing Invisalign or whatever it is that I'm going to do, and that's more important. So I need to do that first. So once I've straightened my teeth out on the right side, then after that I can get a mouth guard. The only mouth guards that I've tried in the past were like quite large and bulky, and now they actually make some that clip onto, I think it's the bottom of your front teeth, and it just keeps your mouth slightly open so that if you do clench down, your teeth aren't making contact. And that's, I think, what will be appropriate for me in the future, but right now it just was not an option. Sorry if that was a really long explanation, but I know a lot of people are going to suggest it, and that's just why it's not appropriate for me at the moment. But you definitely want to discuss different options with your dentist, and that will give you a good starting place on what might be an appropriate option for you. And if you are considering Botox, definitely investigate whether or not it's a good fit for you. But for me, I am very pleased. I'm really satisfied. I don't know, I just went into it thinking that if it works, great, and if it doesn't, that's fine too. If you guys have any questions about this procedure or questions about my experience with it, feel free to leave them below in the comment section. I will leave Dr. Cabin's information in the description box below if any of you guys would like to reach out or discuss the treatment with him. I'm also going to actually leave my dentist's information below as well, because he's just so amazing. I have never been to a better dentist in my life, and I paid for all of the dental work that I've had, like all of my teeth getting fixed. I had a couple fillings replaced, and I had my teeth cleaned and everything. It was affordable, it was very high quality work, and I would definitely recommend him. So if you're looking for a dentist in Los Angeles, I'm also going to leave that information below as well. Hopefully you guys found this video helpful and informative. If you guys want me to do a follow-up video on this in maybe 4 to 6 months when the treatment starts to wear off, I can also do that. So let me know. Thank you for watching. I will see you all very soon in my next video, and I will talk to you then.